Okay, so as people are still filtering in, I just would like to say hello and welcome to the Smart City Kids Executive Function and Adolescent Mental Health Workshop. We would like to extend our sincere thanks to families and allies at Blackrock and the Ability Network at Blackrock for hosting us today. And a very special thanks to Ashley Messig for the introduction to Blackrock. My name is Erica Papier, and I'm an advisor at Smart City Kids. I'm also the parent of a rising 4th grade boy and 8th grade girl. So if everyone attending today would please take a minute to note in the chat how old your child is or what grade your child is entering this fall, that would be tremendously helpful to our presenter. So now would be a wonderful opportunity if you could go ahead and just make a note in the chat of the grade of your child. I just want to briefly introduce Smart City Kids, so you know we are here if you ever need us. For over 20 years, Smart City Kids advisors have guided parents and students through the admissions process for entrance into all grade levels, starting with the little ones in nursery school and continuing all the way through college admissions, including boarding school and special education. We work with families throughout the New York area, as well as across the globe for families who are relocating. Smart City Kids has clients who are schools and corporations like you, and we provide guidance about parenting, education, and admissions. We also support corporations when they are recruiting new talent by helping to find schools for the relocating families. Lastly, parenting is complicated, and our advisors offer parenting sessions where we discuss parenting and education-related topics. We also have an extraordinary group of highly experienced tutors who support students of all ages and abilities if your student is ever in need of extra support. I am honored to have the opportunity to introduce you to my most impressive colleague, Dr. Evan Flamenbaum. He is an advocate for children, adolescents, and young adults who experience mental health and academic issues. He holds a doctorate in clinical social work as well as an MA in school counseling. As a former dean of students at a prestigious private school, he used his clinical knowledge to help students stay in school during periods of difficult psychological adjustment. As the current head of School of Academics West and co-founder of Therapy West, Dr. Flamenbaum continues to integrate his clinical knowledge and background in education to train and guide professionals and parents like us. He is a nationally recognized lecturer and considered an expert on the treatment of learning issues and ADHD. Dr. Flamenbaum also co-created Clinically Informed Academics, a research-based model that provides a framework to improve the overall functioning of students socially, emotionally, and educationally. He will present for around 45 minutes, and then we will leave time to answer questions at the end. So as we're going through our presentation today, if you have questions, please put them in the chat and we will pose them at the end. I also wanted to share that Smart City Tutors is offering a promotion today to those who attend this workshop, either live right now or later through the recording. We are happy to provide a complimentary 60-minute executive function tutoring session. So if you're interested in this offer, you can email me. I'll put my email in the chat or contact Melanie at Blackrock for more details. So thank you. I know it's the middle of a busy workday. Thank you so much for taking the time to join us today. And I will turn the floor over. So thank you very much. Take it away.
Okay, we're going to share our screen, our PowerPoint. Thank you so much, Smart City Kids, and thanks to all of you for giving me a little of your time today. I promise you will walk away with some very helpful and tangible tools and tips that you can immediately use. But before we do that, I would like to vent a little bit about my day. So I have a junior in high school and a freshman in college, just so I'm coming at this as a parent. So I woke up, I typically give myself about 30 minutes to, just watch the news, which actually is not that relaxing, but my daughter found me in my 30 minutes of free time I have every day and asked me to edit a paper, which she had to turn in today. So that was my 30 minutes, showered, dressed, went to the train station. I live in the suburbs. Of course, my son's car was blocking mine, so I had to deal with that. I'm running late, reprioritizing how I'm gonna, where I'm gonna park and shave off a minute. I get on the train. I get a call from one of my staff. They're having an emergency, a risk assessment, a whole thing. While that's happening, the conductor of Metro North comes by and I have to pull up my e-ticket on my phone, which if you're in Gen X, this is like, juggling 7 balls to do for me. Finally get into Grand Central, take 2 subways, get out, get to work, first get my coffee and the iced coffee for my partner, get upstairs, I'm 1 minute early to my 8:30 meeting and my day starts. So we all live like this. Our life is actually, we have to manage a lot every day, especially as parents. Okay, there we go. It takes a tremendous amount of executive functioning to go through our lives. That was my life to 8:30, and it has been like that all day. We have to manage our time. We have to make decisions on the fly, reprioritize how we're going to do it, what we're going to do, what's important. And we're constantly shifting our attention to where it needs to go. So let's apply that to kids. We're asking a lot of them. Life is really complicated. The reason I got into this topic as my area of focus was I felt that how to help people, especially young people with executive functioning, was critical. If we don't have adequate executive functioning, we really have an incredibly hard time navigating our lives. As a therapist, I saw no matter how much schooling a kid went through or how much therapy, it didn't really matter if they didn't have adequate executive functioning. It was sort of like the tread on the tire of your car that allows it to gain traction. Interestingly, whose job is it to help people with executive functioning? I have several graduate degrees in education and mental health fields. I never took a class on it. Whose job is it? Who's really a specialist? And of course, there's this field of people that are learning how to do it. But I felt as a clinician that this is really an area of training, that people, if this is so important, if this is the fundamental process that allows us to function every day, why are we not making it a priority? And I'm sure this will resonate with you parents. The pandemic really amplified all these issues. If you had some executive dysfunction in the past, it got worse. If you had some anxiety, it got greater. If you had some depression, it got greater. The pandemic really was the great amplifier. And the literature is really clear about one thing, which makes a lot of sense to me. Any sort of chronic mental health situation, anxiety, stress, depression, you name it, is accompanied, it's axiomatic really, that it's accompanied by some degree of executive dysfunction. So those of us helping people with any sort of social emotional issue really need to understand executive functioning, because whether we want to or not, we really have to help our students, our clients, our patients, our children, we really need to understand how to do so. So today I'm really going to give you some high utility tools. And what that means is, and I'm sure I'm going to make you a promise, most of it you haven't seen before. What that means is the evidence says it works, the research says it works, and it's easy to use. I don't want any parent, teacher, therapist, certainly a kid, to have to struggle to utilize some of the skills we're trying to give them. So let's start with, I'm sorry, we keep on letting people in while we're doing this, so it's a little distracting. So I'm going to go to the next slide. Let's just quickly define executive function. And there's lots and lots of definitions out there. So I'm just going to distill it into what I would say its most sort of salient aspects. One is working memory. So we're going to use a metaphor today, the hands. We can only hold so much stuff in our hands. So all of you who are, closer to my age or more, see if you can remember your phone number when you were like 8 years old. 772-3643, 212, grew up in Manhattan. Once we get it from our hands, our working memory, to our long-term memory, it gets stored in our mental filing cabinet. So if you don't have adequate working memory, you don't learn. It just kind of falls off. And I'm sure you all have colleagues, friends, children that things don't seem to stick. Even though, oh, I got this, Mom. I know it's on the quiz, and then they don't do well. They think it's stuck, but it really hasn't made it there. So working memory is fundamental to learning. If you can't store it, then you can't retrieve it. Mental flexibility is really our ability to shift attention and sort of be able to be flexible in the moment in the constant demands of the world. And self-control, if any of you took Psych 101, is the sort of like the marshmallow test, the how to manage your frustration tolerance. And these are sort of the three sort of general domains of working memory, of executive functioning I want to talk to. One of the best metaphors I ever heard was, Ned Hallowell. I don't know if everybody knows him, but he's a real expert in ADHD. But Ned said, a lot of people have great orchestras, but not great conductors. So on the next slide, I want to show, these are the typical sort of parts of the orchestra, the different areas of the orchestra that we're always trying to conduct. So for a second, think about your kid, yourself, anybody you're interested in. What area of the orchestra might they need support with? Where do we need to help that conductor conduct? Is it making decisions, starting and stopping tasks? A lot of kids with really poor executive functioning experience as not a teacher. You keep on telling them stuff like, hey, you got to take your key today to get back home. Take your key, take your key, take your key. It doesn't stick. How to have, all of us are in the work world. You are all in a very complex system. So you have all sorts of conversations, virtual, in person, how to sustain those, how to have that sort of social reciprocity, reading all the cues throughout the day, verbal and nonverbal, which really became hard when you just had virtual learning for a while. And of course, taking viewpoints of others, how to sort of step back and understand what people are thinking, and while you're talking, reading the room, so to speak. So these are sort of the areas I try to think about when somebody's in front of me. Where do I need to help you? Where are you not conducting well? So I'm going to go through some of the typical mental health areas, so to speak. This is sort of like, I would say, the big hits, but I've done this lecture for eating disorders, for stress, for trauma, etc. It doesn't matter. Executive dysfunction is always a constant ingredient of all these issues. But I'm gonna go through anxiety, depression, and substance use just to sort of underscore why executive functioning is so important and why it's so impacted by these kind of very common issues. So executive dysfunction is not just a risk factor to develop any sort of substance use. It's also a byproduct. If you're using substances, it will obviously decrease your executive functioning. So when we work with these folks, it's always a chicken and egg kind of thing. And it comes with a whole host of risk factors, things that we really look at young people and they become predictors of an outcome that we're not looking for. And of course, on the other side of the ledger sheet, we're always looking at people and saying, hey, what are their protective factors as well? So reams of research that point to substance use, chronic substance use, decreasing academic performance, lowering self-esteem, increasing social isolation. Young folks, especially adolescents who I see drinking alcohol or using drugs, often find the one group that lets them in, which is usually the group that is not great for them. But they tend to socially isolate, which is a significant problem. Again, tremendously exacerbated by the sort of peak moments of the pandemic. Any kid with a learning issue or ADHD, high correlation to substance use. So it's always something that we are more careful with when kids have those profiles. And I guess my point to the world, and usually when I talk to other mental health professionals, is we must integrate executive functioning support and remediation as part of the treatment plan. It has to be part of the case conceptualization. We can't help anybody with any chronic mental health issue, even if it's minor or mild, without keeping an eye on their executive functioning. Again, we don't have adequate executive functioning, we're going to have a hard time managing ourselves, managing the world, and being successful at work and school. So, depression. One thing every therapist should know is you never want your very, very depressed client to make a decision. They're just not in the place to make a good decision because they have a hard time problem solving, hard time seeing the impact of the decisions and how to make useful decisions, and even being planful, setting goals, projecting a little bit into the future in a rational way. Without getting into the research, and I don't know if any of you follow this, there's been actually a lot of contention in the field recently about using medication or the efficacy of most common antidepressants and its efficacy. SSRIs, the whole serotonin mechanism is under scrutiny. But the bottom line is the medication at this point does not help with your cognitive functioning. It does what we want it to do as professionals. It wants people to feel better and live better lives, but it does not impact those cognitive processes, which we're going to be talking about today. Nor, by the way, I should say, so many students in our therapeutic school are on stimulant medication, which again can be a very, very powerful first-line treatment for ADHD. However, it doesn't teach your kid how to get organized. It doesn't teach them the skills that they need to improve their particular areas of executive functioning weakness. And just juxtaposing your typical signs of depression and executive functioning, there's a lot of overlap. These things are not mutually exclusive, and you're going to see with anxiety as well, a lot of the typical signs and symptoms of anxiety and depression are accompanied by and present themselves as having executive dysfunction. And so none of this, it all makes a lot of sense. I just don't think clinicians look at it this way all the time. So in terms of anxiety, which I think is our next slide. So we all know when we're super anxious, let's go back to the hands analogy for a second. Anxiety, we can only hold a few objects in our hands. Anxiety becomes one of those objects. All of a sudden, I basically have one hand when I'm experiencing chronic anxiety. So even if you look at the DSM, which is our manual where the drug industry wants us to sort of provide people with diagnoses. One of the characteristics, one of the criteria to diagnose anxiety is having trouble concentrating. There's a lot of research that is a little unclear on how to handle it, but we do know that anybody dealing with a lot of anxiety is going to have a hard time learning, they're going to have a hard time focusing, and they're going to have a hard time storing information. So today I'm going to give you some of the very, very high impact tools to, even if you're low mood, you're anxious, you're stressed, you're struggling, these are the things that really, really remediate it for young people, for all of us. By the way, I use it myself. These strategies are great across the board, whether you have a learning issue or you're struggling with something, it just helps in general. And again, the pandemic has sort of put this pall over everybody. Sort of, even when I talk to colleagues who are working with the most high-functioning college students and high school students and middle school students, they're all struggling with their own attention. They all have a lot of stuff taking up some of the space in their hands. So this is just really, really incredibly useful to focus on right now. So I always look at executive functioning. First of all, I look at therapy and teaching as the same thing. I've done both. We're teaching people skills, whichever way you want, whatever way you want to look at it. They really have the same focus. So we're going to look at some very simple ways to do what, the fancy term is cognitive remediation or brain training. But education and psychotherapy have really, really evolved a lot recently in terms of integrating what we know about neuroscience into practice. So everything I use when it comes to executive functioning sort of remediation or treatment is part of evidence-based practice. We know it works. It's really, I see so many people teaching kids things that don't work. Or they're like, yeah, this is how I did it. as parents, we tend to impose what worked for us on our kids. Hey, I used index cards. Well, maybe that doesn't work for your kid. And I hate to say, I see a lot of like learning specialists, tutors, etc., doing things that are not necessarily either what we know works or what works for that person based on available data. So what we do at Academics West is if anybody does have any neuropsychological evaluations, we use that data to drive intervention. And you don't have to have a neuropsych. There's some basic screening tools or even things we use that are really simple that you can basically download them on the internet for free, just to get a bit of a sense of how this person works, how they take in information, what is their learning style, what is their thinking style. You always want to pair the strategy. It's like being a good teacher. You need to know how to get through to that person in front of you. One of the simplest things, some of you might have heard of something called DBT, dialectic behavior therapy. So the world of therapy has really, in the last 10, 15 years, taken a page out of Eastern philosophy and integrated mindfulness, which has been super, super effective. And I've seen it proliferate so much, especially recently. But one of the things, the simplest tool, because you always have your breath with you, is to teach people paced breathing. Literally, what happens is we go from in a few minutes or even less, you can really toggle your central nervous system from the sympathetic, fight or flight, to the parasympathetic, rest or digest. So looking at this, it takes you about a minute to teach somebody to do this, but I've had so many kids who have like test anxiety, or they're about to enter a stressful situation, or parents that I work with a lot. They do this and they literally shift their physiology. When we are anxious or stressed out, we cannot access this mental filing cabinet in our prefrontal cortex. We're locked. I'm sure all of you have had times, you can remember tests in your life where you froze, and then after the test, an hour later, you knew every answer. I've had a lot of kids put their test down, do some paced breathing for a few minutes, come back, and all of a sudden it floods back. So things can be very simple and have a significant impact on people's functioning. I saw, especially that first year of the majority of virtual learning, a lot of kids having to be taught how to do this in the moment. It's such an easy skill in the moment to have a high impact. So the three things that I really want to show you today, that if you don't listen to anything I say, this is it. If I get hit by a truck or a piece of a Chinese rocket falls on my head, this is what you want to listen to. And we call it here the triple threat. Preview, review, self-test is kind of how we teach our kids to do this. What you're going to learn is that the preview really helps with processing. So some people just need a little more time. Some kids' class is going 100 miles an hour, and they're kind of built to go 80 miles an hour. They're always revving their engine. They're always playing catch up. They're exhausted at the end of the school day. And class time really isn't great learning time for them. It is the most common thing we see with kids. The other thing that we want to support kids on is working memory. If we can get that mental desktop, which is working memory. Some people have really small desktops and it's very hard to put things on top of it. If we can teach them to have a bigger desktop and to store things better, such a big plus for them. And of course, at the end of the day, I really want, especially people in school, I want them to perform better. I want to give them every opportunity to do well in school, which is a major protective factor in life, to get a good education, stick in school, have a good trajectory. So we're going to unpack very quickly how to do those things, which is super simple, but incredibly impactful. So, and I don't know, Liz, if I can look at the chat now, but I want to ask everybody a question. So they've been doing this for, I don't know, this research. If any of you took Psych 101 and you remember the Ebbinghaus retention curve, which I hope none of you do because there's a lot more important things to remember. But if you meet the typical person, let's say, high school kid, middle school kid, they just had class, you met them at the door, they just had history class or math class, and you met them at the door, how much does the typical person retain right at the end of class?
Evan, do you want people to answer? I can monitor the chat if you want people
Yeah,
to.
I'm curious. Right at the door, we've done this for the sample size is tremendous. How many people we've looked at? How much you being the typical person? What do you remember at the door?
Someone said 10%.
Okay.
Someone else said 50, 30, 30, 20, 50, 5,
Okay. So
40.
it's hard to predict that. We don't think about that so much. So typically, again, if we look at this huge sample and we get a sort of good predictive number, it's about 70%. You just learned it. Okay, 70%. The interesting thing is a day later, without any active learning, you haven't done anything except the day went by, people go down to about 20%. That's a huge reduction in retention. How about not at the door, but 10 minutes later? Erica, let's see what people think about the 10 minutes later. Not at the door, but you left class, you walked down the hall, 10 minutes later.
One person said even less, 35%. 50, another.
Okay.
49.
Well, very specific number. So in fact, a very interesting phenomenon occurs, which is people actually bump up to about 80%. So here's the fundamental question of all of this, which is really probably the most important thing I'm ever going to say to you. What does that mean if I quadrupled your memory retention over weeks, months, and years? What does that mean? It means you're really smart. If we could quadruple our retention, it would make all of us incredibly capable and incredibly smart, so to speak. And it's a very simple thing to do, and it takes about 5 minutes a day. I have been working on this with kids for the better part of 20 years, and if it's done correctly, which it's kind of hard not to do correctly, it has an absolutely transformative sort of effect on people. So what the research really says, if you look at it closely, is 10-24/7. If people, let's say it's a kid, or even somebody at work, you can apply it. If you look at your notes in class, 10 minutes and then 24 hours and then a week later, 3 exposures, 10-24/7, what happens is people shoot up to that 80%. It goes from the working memory, it goes into the long-term memory, we store it, and it's incredible what you'll hear. It becomes qualitative in some ways. Not only do their grades go up, but people will say things to me like, wow, I really, I'm able to pay attention in class more. I don't have to work that hard to retrieve information. I'm more comfortable with learning. It's absolutely amazing. It takes 5 minutes. What I try to do to make this like more pragmatic and easier to deal with, because it's hard for a kid to like, all right, 10 minutes, 20, just every day look at today's notes and yesterday's notes at some point. It has some secondary benefits too, which is if you're like me when I was a kid and half my notes were wrong or I had omissions, I'm like, oh, I got to go talk to the teacher or the professor or go back to the textbook. It sort of ensures that people have more complete information. But most importantly, it's a very, very simple way to put things into your long-term memory without any effort. What happens to most of our kids is it comes test or exam day, and they're at 20%, they're trying to go to 100% in a day or two. So my father, who's a physician, he sort of figured this out in medical school. He, like me, was, you know, we both had pretty florid ADHD, and we were told not to go to college or grad school. You know, people really didn't think we were going to do much because, but we both kind of figure out some learning strategies. And he in med school, he went to Columbia, would put his notes on a big index card, flip through them. He would write actually careful notes, then put them on a big index card and flip through them a little bit. He never worked very hard before a test. He actually never worked very hard. More importantly, in my mind, he became an excellent physician because he never forgot anything. You know, a lot of people can do okay on the test, but storage of knowledge and being able to be fluent in your craft or whatever you do is really what makes you more effective. So I can't impress, and again, you folks at work, whether you're looking at your memos or notes or what you're trying to do, I try to focus the review strategy on either a subject or an area of your life that you're feeling like is stressful. You don't have to, if you're getting an A in math, don't do it in math. Focus it on where you need it. Try it for about a month, and you're really gonna experience a change in your production and work quality and how you feel about it. The other thing, before we actually get to time management, is the preview strategy. So a lot of folks have processing issues. Again, that has nothing to do with intelligence. Unless you're like, a transplant doctor and, it's, every second counts for life, which is, I think, none of us. It's okay to take a little more time. However, in school, sometimes your time has really got some boundaries on it. So, and again, this is for those of you who are parents, this is actually an important thing to think about over the summer. So during the summer, everybody goes through a certain amount of regression. Actually, math tends to experience more regression than other areas. But going into class, previewing material, creates some hooks to hang information on. So if you have a child who's like, class is going too fast, I'm having a hard time getting it down, or your child is coming home and almost looks like they're relearning information because they couldn't hold on to it, previewing material, looking in the textbook for the bold words, look at the pictures, look at a summary paragraph, get on Spark Notes or Cliff Notes or any of those things. Just look at a summary. Just getting some of the basic hooks to hang it on. There's all sorts of advanced strategies with this where you can take notes on it, but just look at the basics, not deep. And they're going to go into class, and all of a sudden, even if their attention shifts or the class is going a little fast, they can get traction. They can hang it on those hooks. It's incredibly, incredibly powerful. If you're going to give a presentation like me today, you want to just preview your presentation a few times. Look it over before you do it. I worked with a lot of medical students actually. The amount of information was coming at them was so intense that when we previewed it, very simply, don't go deep, it shouldn't take more than 5, 6, 7 minutes. Again, their performance went up, and class time or meeting time or whatever you're doing becomes learning time. So fundamental. And the last part of it is self-testing. And this is incredible. Again, these are the three, according to all the meta-analysis, which is like looking at all the research and distilling out what's effective. The adage is neurons that fire together, wire together. So you sort of keep on deepening those circuits. What a lot of kids do, and they trick themselves, is they're studying for a test, and they just look at the book, like, I got it, because it makes sense. At the time, they do. But then they get to the test, they don't know how to perform it. So those people that, you always take the test before the test. You always play the scrimmage before the game. So I try to get kids to profile their teachers. Does your teacher multiple choice tests, true and false? Are they short answers? Do they take it out of the notes, the PowerPoints? Do they take it mainly out of the textbook? Where's the information coming from? How's it presented? Play that scrimmage. It is the most powerful tool I've seen in kids just getting better grades, simply. Study the way the information is presented, but make sure you fire the right neurons. Don't just look at the math problem, perform it. You literally myelinate those neurons. You insulate them so they fire better. So get, my son, who, thank God, he's a wonderful guy, but that's what he would do. He would just like, I got it. And then he'd be surprised he couldn't do it. I'm like, you did not play the game before you played the game. So preview, review, self-test are probably the most effective. They really, in my experience, like 95% of the executive dysfunction I see in young people takes care of it. Their processing is better, their memory storage is better, their performance is better. It was simple, it was easy. I didn't have to convince them too hard to do it. If it's complicated, kids won't do it. The other thing we hear a lot of is not just kids. I mean, a lot of the work I used to do with kids, the mom or dad or somebody would be kind of peering over my shoulder like, that's really interesting, I can use it for myself. So we try to sort of assess people's time usage using the time quadrants. It's a very simple way to sort of see how you use your time or your child, but I also kind of tie in for people the impact of time usage on mental health. So, many of us procrastinate. So the people who make things important only when they're urgent, like when the fire's under your tush, that's the procrastinator. You do it only when you have to. There are times that we can't avoid it. We want to manage that. But if you are a chronic procrastinator, that is the zone of the quadrant of stress and anxiety. Because and again, think from the learning perspective, you're not really storing it in that long-term memory. You're just getting through it. So we want to manage that. Those people make things urgent that are not important, which was like me in high school. I always wanted to help my friends. Helping people with their goals more than yours, again, helping people to a certain extent is really pro-social and helpful. But when you're spending more time on other people's goals than your own, you become sort of the yes man or the doormat. And that's the quadrant of low self-esteem. And I've seen that really, really debilitate a lot of young people. My favorite is the, nothing's important and nothing's urgent. The slacker, the too much, I eat too much, I sleep too much, I play too much Xbox, etc. Again, you all work very hard. There are times you're like, I need to take a day or two off and just regroup, of course. But if you're spending too much time there, that's not good. We want to get everybody towards the upper right. Think about in college when you met that person who had really great grades, but was at the parties, they were on a team, a club. They seem to do everything, have great relationships, and do well in school. That's the prioritizer. They make things important that are not urgent. The paper's due in 3 weeks. I'm going to go to the library. Well, nobody goes to the library and gets books anymore, but I'm going to start the outline now. I'm going to start my research. I'm just going to write the heading on my lab report today. They pick away at things. They never get stressed out. And they actually tend to be more functional, healthy people. So we want to push ourselves and the people we love that we're trying to support towards the quadrant of prioritization. I'm not going to get into this deeply, but when you work with young people, you have to be a behaviorist. Everything is behaviorism. How do I get somebody to do something, basically? And when we look at behavior, think about that thing that puts you down the rabbit hole. Is it the text that comes in, all of a sudden, YouTube pops up and you want to do that? What is the thing that really gets you in the way? And if any of you study behavior, the ABCs, the antecedent, behavior, consequence. So these reactions are so habitual, you don't even usually know when you've started to engage in your avoidance behavior. Matter of fact, when you or your child starts engaging in something they don't like, it actually lights up the pain center of their brain. What do? We will do anything to avoid pain. So the main goal is to remove the antecedent. If you put potato chips near me or cookies, I'm going to definitely eat them. So in college, I used to go to the library because it was a place where the antecedents that got me in trouble, like my friends, and etc., removed them. Again, this is about habit formation. So if everybody can put their thumbs out like this, one thumb across the other, can they see me? Mm-hmm. Okay, I can't see you, you can see me. Now, flip that. That feels weird and uncomfortable, but if you did it for a while, it would feel okay. So we're often asking people to put their thumbs in the wrong way for a little bit. But we want to cue people to a place of less pain. And this is where we want to intervene to rewire an old habit. So I used to have a teacher, it used to annoy me, but it always stuck in my head, the old adage, failing to plan is planning to fail. The truth is, if you want to change your habit, let's call it procrastination is the habit we're talking about, you have to have a plan and develop a new ritual. So this may take some time and adjustment, but eventually changing habits, as we all know, has a tremendous benefit. And again, we want to think incrementally. We're not going from the top to the bottom to the top. There are, it's steps. And again, the other thing, and we do this, I run a therapeutic school, so we're always thinking what we need to change in the environment to get our kids kind of to doing things that are really healthy for them, that are pro-social, that really have a positive impact on their functioning. You have to reinforce behavior. If I'm going to change something, I want to shape it through reinforcement. So why are you procrastinating? I'm sure everybody in this, we all procrastinate. Some people just, why are you intrinsically motivated to change what you're doing wrong? Is it just because you have a sense of pride about changing it? Is like, I want to get a promotion, or negative reinforcement, which is like, I got to remove something that's bad in my life because I keep on getting written up by HR, or my mom keeps on yelling at me. Make it personal. I always make internal bets. I challenge myself, but whatever that thing is that cracks your code to motivate you, it could be, I'm going to have the treat at the end of something. You need to change a habit. You need a reinforcer. You need to remove the antecedent, have a reinforcer that resonates with that person. So whoever you're working with really has to be part of that process. I take a break, I take a walk, a call. Some people like to just go buy a small purchase, a little shopping, therapy. Something that we want, when we remember the positive part of an experience, like athletes will often get a massage at the end of a very hard workout. They remember the massage, not the hard workout. And most importantly, and when I work with young people, young adolescents, even young adults, is they have to believe they can do it. Really working with people that this can be something that they can change. A lot of people develop what they call learned helplessness. They kind of believe they can't change it, and it becomes part of them. We don't want that to happen. Young people are wonderful because they're malleable enough to change that. So you have to be a believer, especially when things are stressful and you're naturally inclined to revert to your old habits, which that always happens as part of the process. So I like to have kids have an accountability partner, somebody which they're okay talking to, who's like keeping them kind of honest. Sometimes kids just do well with not a parent bothering them or involving themselves, just being in the room, just something or somebody that really helps them focus on what they need to change. That's why all the research is pretty clear. When adolescents hang out with the right crowd, they often internalize their habits, routines, and values. And I've always thought as a parent, I'm like, I want to know who my kids are hanging out with for a lot of reasons, but a lot of it is because that becomes kind of their value, an extension of their own value system. The other thing just to touch on is goal setting. If goal setting was easy, January 2nd, we'd all go to the gym, lose weight, etc. People are really good at the what they want to change. It has to be measurable. I can't be like, I want to do better in English. I want to B+ or better. What they often miss is the objective, the how. How am I going to do it? How am I going to make more friends or get that A or raise my hand more? Or, how am I going to do it? What are the steps I need to take? And the other thing, which if you've read any of the research on intrinsic motivation or growth mindset, is why? What's in it for me? I always say to kids, well, what's in it for you? I want to go to a good college. I want to feel better. I want my parents to stop nagging me. I mean, everybody's got their own reward, but being able to be explicit about it, show it and think about it, really, it's amazing how much it helps people achieve those goals. Just saying what it is not enough. How you're going to do it and why you're going to do it, we like to have as parts of ingredients for why people do things. And a lot of this actually comes out of sports psychology. Athletes are fabulous at goal setting. They're always trying to, I watch a lot of tennis, improving their volley, their ground stroke, their serve. They're always tinkering. So a lot of what we know about what works comes out of sports psych. One thing that I think is very simple, but again, it goes with the neuroscience is, marathoners, for example, they don't think of themselves as running 27 miles. They run 1 mile 27 times. And so I always talk about process versus content, or outcome, I'm sorry. So the outcome is like the marathon. Don't think about it. Actually, people do better when they go into autopilot. So if I'm like, hey, Liz, you have to read this 200-page book, that actually activates the pain center of her brain and she becomes avoidant. If she said, oh, I'm just going to read, 5 pages at a time, I can do that. I can actually go into autopilot. Autopilot is good. Sticking with the mundane little units that string together for the outcome is really important. So avoid focusing on the outcome versus the simple, really mundane processes. I see so many kids failing because the anxiety, you know, the old thing, like how do you eat an elephant one piece at a time? So important. The neuroscience, when they show people literally working on the process, the boring little pieces, the reading the 5 pages, actually get through material better, avoid things less, and have better outcomes. We're probably running a little out of time, so I'm going to skip over this one. The bottom line is people that take more breaks actually increase their retention. So when somebody says they studied 5 hours straight, that's not smart. Taking breaks actually allows people to rejuvenate, store information. So basically, when I tell kids, hey, take a 5-minute break and you're going to learn more, everybody's on board. Nobody rejects that. So it's another really passive way to improve executive functioning, and force people to understand overdoing it is not helpful. You could just look at this slide. What this really underscores is what we call cognitive behavioral therapy. Just changing people's self-talk, how they look at things, how they describe things. People are very, very self-punishing. I have to, I should, I must. Think about your kids. They ever say that kind of very, very absolute, intense language? Versus if we can make things more flexible as a preference, well, I choose to do it. I would prefer it. I must finish. When can I start? Reframing, cognitive reframing is so powerful in how it impacts behavior, because you feel better, you're less stressed out. I have to do it, I should do it. The world's going to be critical if I don't do it. If you can reframe that, you will feel better, and then you will function better. So cognitive thinking, behavioral, CBT, that's why we do it. But it's so impressive how I see it help people with their own productivity. So ask your kid, what are you thinking? What's going through your mind? Well, if I don't do this, something awful will happen. I should, I have to, I must. I'm stupid if I don't. All that kind of stuff. Try to help them reframe it. These are sort of my top hits for procrastination busters. Again, there's lots of ways to do it, but I've sort of distilled out a lot of the research I've seen to find the most effective strategies. Some people are more temporal oriented, time. Some people are more task oriented. Mark Twain said something like, if you eat your frogs first thing of the day, then the rest of the day seems easy, something like that. So I try to get people to eat their frogs first, the worst first. And then the other strategies really come out of cognitive behavioral work, which if anybody's interested, they can contact me. But there are a lot of great techniques that really help people who are stuck or avoiding really complete things and improve their overall executive functioning. So that's it. I kind of gave you a mid-level dive, enough to really understand it, enough to really sort of grab onto it. But I wanted to create some time and space for questions about how you want to apply it in your own work.
Sure. Thank you so much. This has been tremendously informative. We do have some questions that I'll pose to you in the chat. So the first one says, is it unproductive to talk about these things directly with your kids? I often speak to my kids in a psychologically driven way to help them understand why they do what they do and how their actions impact others and how that makes the person feel, et cetera, et cetera, et cetera. How do we implement these things?
Hey, if every one of our kids listened to us, you would not need therapists in the world, right? Well, I mean, one thing, first of all, every kid's different, and you do have to think about your relationship. And there's a million parents in my career I've said, hey, your job is to be mom or dad and not the homework Gestapo, like things like that. But one thing to think about, there's something called motivational interviewing, which was really a technique or approach developed to help people who weren't changing. We wanted them to do something, but they were kind of ambivalent about it, how to get them to change. And one of the concepts is what they call the writing reflex. And parents, all of us parents are guilty of the writing reflex, which is we're kind of trying to tell our kids what to do. And motivational interviewing can be kind of counterintuitive in the sense, the metaphor is like, if you're going into a skid, your natural instinct is to go the other way. What I'm telling some parents to do is to actually go with the skid, to join the resistance, to actually go with what they're saying. And what the research indicates, when you do it right, it actually develops what we call change talk. when you tell your kids that if you want me as a kid, when I was 15 to do something, don't tell me to do it because I will absolutely go the other way. But when you said to, when you, when we're talking about something and you join me on it, I might start saying, well, actually, talking to the teacher, yeah, maybe that would help. Giving yourself, it's really hard to be patient, but joining the resistance, so to speak, leaning into them versus controlling might actually allow them the supported space to come to those realizations. That's something really to think about because the writing reflex almost never works. But it's hard for us. We're like, I know what you need to do. I get it.
Okay, another question. What if we would like to help some other question just jumped. What if we would like to help our child to do better in school and they just say they don't care? How do we help them care?
Well, first of all, I think every kid cares. I really do. I used to hear from parents, my kid's not motivated. I'm like, oh, do they like video games? Yeah. Do you have to motivate them to play video games? No. So we need to figure out why they're not motivated to do school. I don't think people are intrinsically don't care. And usually it's a self-protective factor. They feel like they can't do well. There's something that's causing them stress. Again, if it really impacts their functioning really deeply, everything begins with assessment. Like you might have to actually go get evaluated and figure out what's underpinning that. Or again, taking that point of view is they do care, and what is the function? Everything serves a function. What's their function of saying they don't care? Why are you saying that? What is causing pain? You want to figure that out. And I try to just get as much information as I can. Talking to the teacher or the coach or somebody else who spends a lot of time with your kid, you might get a lot more insight. Believe it or not, if you have the opportunity and it's appropriate to talk to their friends, every kid has a second family who's an adolescent. Their second family knows a lot more about them. And sometimes you can get some tremendous insight. We used to have a lot of kids come to us. The parents like, look, they're never going to want to come to your therapeutic school or do your executive functioning work. And one of the things that used to work, I'd say 95% of the time for me is say, hey, Valerie, I see you, Valerie Walker, that's why I'm saying your name. Look, we have a lot of things we can really help you with here. I think there's a lot of ways to make school easier for you. But look, if you don't want to do this, don't tell me now, Valerie. Like, go home, think about it. I'll call reach out to me or tell your parent. I'll tell them that you're not interested in school or doing this stuff. Not a problem. But Valerie, if you come back and you talk to me, you're definitely going to do great. But you don't want to? No problem. It just, and my friend and colleague, Dr. Casanova, I see his face. He used to always say, kids don't go to therapy or go to school. They're brought there. They need to have some control about wanting to bring themselves back. And so when I used to do that and give kids ownership of like, it's kind of my choice, all of a sudden they would maybe be more interested in exploring why they're not doing well in school or why they're not feeling well. They just they have so little control. I always keep that in mind when I'm figuring out how to approach them.
Those are great thoughts. There's several more questions. I think maybe we have time for one or two more. So your idea was so wonderful about having students reread their notes on a more regular basis. When they have a very heavy homework load and they're just trying to keep their head above water on a night-to-night basis, how do you recommend and when fitting in that review on a regular basis?
Right. So that's a really good question. And so here's what I've learned from experience, a few things to think about. One is, first of all, the literature calls it like enrolling a kid. Like, how do we enroll you in this? Especially kids who are really struggling in school, they're really just falling apart, they're in a deep hole. It's really hard to say, hey, and I want you to try something extra. I get that. So first of all, timing is important. When I would see a kid who's like, I just failed, I failed my 4th math test in a row. That's when I'd say, look, it's not working. We tried it your way. Let's just 5 minutes a day. That's all it is. 5 minutes a day. let's actually talk about the 5 minutes. Is it your bus ride? Is it sitting in that your pediatrician's office? Is it looking at the notes in the elevator? Is it just when you're watching TV, looking at your notes in the commercial? They find, okay, I can do, you can find the cracks for them to commit to, but also it cues them. You want to give them, you actually want them to define the time they use, and they're like, oh, I actually have that 5 minutes, it's there. But you want to do it when they're like, you know what, it hasn't been working, and I'll say, look, let's try it for 3 weeks. If it doesn't work, throw it out. Again, giving them some control, finding it at a pain point where they're more interested in hearing it, and then defining that time or location to cue them is really, really important. Everybody's got 5 minutes. I'm like, oh, okay, I'll do it on the, kids I used to work with went to Riverdale or Fields, and like, I got a 20, I'll do it in 5 minutes. That's really, really helpful. It increases the odds of them doing it a lot more. And starting this at the beginning, we get a lot of kids who are like, we get them in like February and they're like falling apart, and they really do have a hard time trying something new. If you can start this in the beginning of a semester or a year, it is really predictive of much better outcome.
That's fantastic. This has been really, really wonderful. It is already just about time. There are a few more questions in the chat, but unfortunately, I don't think we're going to have time. We will share with Melanie the recording and a selection of the slides from today's presentation so people can review it at their convenience. But I would really like to thank the families and allies at Blackrock again, and the Ability Network at Blackrock for the opportunity to share this executive function workshop, and a tremendous thank you to our very knowledgeable, inspiring presenter. For those who joined late, I just want to again mention that Smart City Tutors is happy to provide a complimentary 60-minute executive function tutoring session. So if you're interested, I put my email in the chat, and Melanie will have it as well, so she can pass along to those that are interested. So thank you again very, very much. Thank you to Melanie for helping to coordinate, and we hope you all have a wonderful rest of the day.